when insurance provides no assurance. Compared to other first world countries, our healthcare system is designed for people with money, or those who have great insurance. The cost of treatment for patients with low back pain is estimated to be $240 billion a year, and that's in the United States alone. With the rising cost of healthcare, the percentage the patient is paying is rising even more quickly. Suddenly, a $500 deductible, which used to be common, is now considered a godsend. You're probably familiar with how much your employer deducts from your paycheck or how much you pay out of pocket for your insurance premiums. You also probably understand that every time you go to the doctor, the amount that you're paying is only increasing. Year after year, the amount of money that you're spending even at the doctor is going up because of the co-pays, the co-insurance, and the deductibles. And you're getting less for paying more. I don't know anyone that says they're getting their money's worth from their insurance company. Not even the people who used to think that their insurance covered everything. At one point, these patients would come into my office confident that their insurance covered 100% of their care. When someone says that, the first thing I do is check with their insurance company, because I know there is no way that there's no copay. No copay, no deductible, no way. Those days are long gone. It's sad because Blue Cross Blue Shield still makes these silly commercials with smiling patients talking about how their insurance covers their health care and their medical needs. They even take it a step further and they present happy doctors using silly taglines such as, "When you're covered by Blue Cross Blue Shield, your family." It is laughable. Now, it may give you the warm and fuzzies inside when you watch the commercial, but it's not even close to the truth. Now, even preferred provider organizations, or the PPO plans, which used to allow you the flexibility of going anywhere you wanted, basically for any treatment you wanted, are like health maintenance organizations or HMO plans now. Traditionally, if you had a PPO or a preferred provider organization plan, you were able to see any type of doctor you wanted, such as a specialist, without having to be referred from your primary care doctor. You could even see doctors outside of your network, and insurance would cover some portion of your care. As a result, PPO plans have usually had higher premiums and higher deductibles, but much more flexibility. HMOs, on the other hand, prevent you from seeing a specialist without first seeing your PCP or your primary care doctor and having to be referred. If you see a doctor outside of your network with a PPO HMO plan, there is no coverage. Now, while an HMO plan is more rigid, it typically has lower premiums and deductibles as a result. If not, so much of the case, this isn't the case anymore. It just isn't. If you have a PPO plan now, you might still be subject to these pre-authorization plans, or you might find that your network is getting smaller and smaller. And in short, you're paying a PPO price but getting an HMO policy. Plus, there's the possibility of your insurance denying services because they're not medically necessary. Or you may have a medical utilization company, such as OrthoNet and American Specialty Health Network, just to name a few. Try to cut costs by creating additional hoops. That's what these plans are designed to do, before they cover any of the services that you expect. 60% of our practice has no insurance or is underinsured. And when you come to our office, we have a team of people dedicated to prepare these complimentary benefits checks for you so you know what's covered and what isn't before any services are incurred. In fact, it's not uncommon to take advantage of our cash price and skip the headache altogether. For more information or to schedule an appointment, go to our website at www.chiropracticsportscare.com and click on Schedule an Appointment.